This meeting is being recorded.
A very good evening to all. I am Nishita from ClearNet. Welcome all the doctors to today's webinar, Federation of All India Medical Association Presents Female Leadership in Healthcare. ClearNet is proud to be associated as a digital partner. Now, I am going to play a short ClearNet's video. I would like to request all of you, please have a look. Thank you so much everyone for your patience watching. Now I would like to hand over the session to Dr. Venkatesh Karthikeyan sir. Sir, over to you.
Thank you. Very good evening everyone. I'm Dr. Venkatesh Karthikeyan, MD Community and Family Medicine Postgraduate Resident at AIIMS Patna. I'm glad to know that more than 100 doctors from lengths and breadths of the country have registered for today's webinar. As we know, women comprise 70% of the globe's healthcare staff, making the healthcare sector one of the few sectors that hires more women than men. Representation in the workforce does not always equate to higher representation at the executive level. It is obvious from the fact that women only equate to 25% of the senior leaders in healthcare. One of the sticking points for women reaching leadership role is that they face difficulties building networks with predominantly male senior executives who can play a vital role in helping employees climb the leadership ranks. The dearth of female leaders in healthcare is a problem, but matters of diversity, equity, and inclusion are just the tip of the iceberg. The issue can also come at the expense of financial stability and patient care. In order to introspect into this with a magnifying lens, FAIMA is organizing this webinar under the leadership of National President of FAIMA, Dr. Rohan Krishnan sir. On behalf of FAIMA, I welcome all the participants who have joined in today's webinar. I would like to introduce our resource person for the day, Dr. Radhika Batra ma'am. Ma'am is a pediatrician from New Delhi. She is the founder and president of Every Infant Matters, a non-profit organization dedicated to the upliftment of disadvantaged children worldwide. Its flagship programs is preventing blindness in children by improving nutrition and dispensing vitamin A. Since its inception in 2017, it has successfully prevented blindness in more than 54,000 malnourished children. Aside from that, they work in areas pertaining to maternal well-being, deworming in children, counseling young mothers regarding good practices in childhood, removing stigma, promoting gender equality, and have focused a lot of their energy into COVID relief in the last few months. A big part of the work involves advocacy with stakeholders and educating communities to reduce instances of gender-based violence, female genital mutilation, and protection of young girls from sexual predators in African and Indian communities. Ma'am also believes in inclusion and health equality and wants to ensure access to healthcare for all. She's a Forbes Asia 30 Under 30 honoree, a TEDx speaker, a Young World Ambassador, a Trust Changemaker with Thomson Reuters Foundation, WEDU Rising Star and Changemaker, a Global Peace Index Ambassador for Institute for Economics and Peace, Sydney. Ma'am is a prolific writer as well. She loves mentoring students and youngsters in different walks of life. She has delivered several guest lectures and conducted several workshops on social entrepreneurship and has been the jury for on-campus rounds of the prestigious Hult Prize at several reputed universities across India and abroad. With this brief intro, I would like to welcome Dr. Radhika Batra ma'am. Over to you, ma'am.
Thank you so much, Venkatesh, and thank you so much, Dr. Rohan, for giving me the honor of speaking on this prestigious platform. Thank you so much, members of FAIMA. And I'm very glad that, just in International Women's Week, FAIMA has organized this webinar regarding leadership in healthcare, specifically when it comes to women, and how in the medical profession, women are, even though we don't like to admit it, women are a little sidelined when it comes to leadership roles and administrative and managerial roles. It is a little bit of how should I say, it's a man's world in the medical world, but I'm happy to see the trends shifting in the last 5 to 10 years, and I'm happy to be a part of that shifting trend. So I'd like to tell you a little bit about my journey to all of you listening, and how in the COVID pandemic, when everybody was looking for some sort of leadership, we were able to, successfully channelize some thoughts and set up a COVID task force, which has helped 32,000 patients till date. Of course, with the help of FAIMA, with the help of IMA, with the help of a lot of us resident doctors. I'm sure a lot of you are listening were a part of that initiative which I had started. But I'd just like to tell you a little bit about what all we had done. So this is just a brief introduction. I have some slides prepared. And Venkatesh, is it okay if I share the slides?
Sure, ma'am. Sure, ma'am. Please.
Okay, so when I'll be speaking, Venkatesh, just to clarify, the target audience is medical students, or is it seniors also, or who's listening right now?
It's mostly junior doctors, ma'am.
Mostly junior doctors. Okay, perfect. So I'll take it on those lines, because I know what goes on in the minds of all junior doctors. So we'll take it from there. Okay. So just give me a minute. I'll start the slide sharing. Yeah, slides are visible.
Yes, ma'am. Yeah.
Okay, so let's start with what is the kind of journey that we go through as medical residents and doctors. So I'm assuming that most of everybody listening is either a PG or an intern or maybe even an MBBS. So I think when we're an MBBS, we are posted in clinical wards, specifically those of us who are in government hospitals, and even if we are in a private hospital, the patient client group is usually low socioeconomic background, and those are the kind of patients we meet. Initially, it is very, very overwhelming to see children die, to see even adults die. Your first death is something that really shatters you beyond the core. They say that it just makes you you become a doctor the day you see a person die in front of your eyes, and there's nothing that any doctor in the world could have done to help that patient. So I think all of us have been through that experience, or we will go through that experience very soon, even if we haven't, to the medical students who are listening. And not just death, we see a lot of very, very heart-wrenching misery as well. Because I remember when I was an intern in RML hospital, I remember seeing a patient who had necrotizing fasciitis. And as you all know, necrotizing fasciitis is something which is excruciatingly painful, and it is a debilitating sort of illness. There is no as such treatment, and it requires regular dressing. And I remember that, they used to, the surgery postgraduates used to tie the hands and legs of that patient and then do the dressing, because it was that painful. So these are the kind of miseries that we see. And, after being for 10 years in the field, after being in the medical profession for 10 years, you understand that there is a difference between what you can prevent and what you can't prevent. So there are diseases that babies are born with. There's Down syndrome. There are pediatric cancers. There are a lot of, congenital syndromes that we have no control over. So after, I would say, after some time in the field, you just get used to these problems. You don't feel as bad about them as you initially did. So suppose you see a child who is born with, say, Edwards syndrome, or who is born with anencephaly or any neural tube disorder. Initially, you will feel very bad, but you'll understand that this is something which the child is born with. Even if you had done everything in your power, there is no guarantee that you could have prevented this outcome. But there are certain illnesses, there are certain disabilities, there are certain problems which interventions, machines, medical science, and resources can prevent. For instance, blindness because of vitamin A deficiency, vaccine preventable diseases. There's measles, there's the children die of measles a lot. I have seen a child die of rabies, and rabies is something that you and I take for granted, that if we get a dog bite we will get the vaccine done, we will get an injection. But that is not the case. There are 40% of children in India who are not immunized, despite the government having extensive universal immunization program, Indian Academy of Pediatrics reinforcing it, all WHO, Indian government, Mission Indradhanush, everybody is focused on vaccination. Yet 40% of children in the country are not immunized, and all of these problems lead to hiatus in the vaccination drive, and they lead to problems which could easily have been prevented. So my thinking throughout my pediatrics residency was just this, that why are we not doing something to prevent these problems? Because these are things that can be prevented. These are things which we as doctors can do something about, and it's just a matter of our hands being tied because of lack of resources and lack of opportunity. So I think the journey begins when you take that decision that, okay, I want to do something about this problem. It could be anything. Like for me, it was vitamin A deficiency. For you, it could be rabies. It could be, the cerebral palsy. It could be anything. It could just be the fact that why are there not enough ventilators in COVID wards, or why does the country always have a ventilator crunch? It could be any problem. And that is where your journey begins, that okay, this is a problem I feel very strongly about, and I want to do something to pick up this issue and do something in this field. So for me, that point was vitamin A, and I decided that these children going blind because of lack of vitamin A. Vitamin A is something that you and I, we get from our food, and 1 million children become blind every year because of vitamin A deficiency. 250 million children suffer from this deficiency, and it only and only occurs because vitamin A is lacking in the diet, because people don't have the money to buy nutritious food. So for me, it was this problem. So I picked it up, and I decided that it was my focus. So for anyone to pick up any issue and want to do something about it, the strategy is such. First of all, like I said, you decide a focus, and then you decide what your model or what your business plan or what your idea is to fix this problem. So for instance, if I want to improve vaccination, I have to understand where is the problem. The problem in vaccination is that there is a lack of last mile delivery. There are places in islands, there are places in the mountains of Manipur and Northeast where there are no healthcare centers for miles and miles. So if I tell a person who is a daily wager that you have to walk 100 miles and you have to miss a day's work and forego the money for that day to get to get vaccination for your child, you're not even sure that vaccination is going to be effective, and then you are trying to convince a person to do this, and then this is what the kind of response you get, that we're not going to do it. So this is the reason why most of the children are not immunized. Either they are not, the parents are not aware, or the parents are not convinced, or the parents don't have the luxury of missing that day's wages. So the problem is multifold, and the best way to do it is to take the intervention to the doorstep of the people, so that they don't have to go those 100 miles, they don't have to travel that much, and also to give them certain awareness about what is beneficial for their child and what is not. So that is going to be, that is like our model, that we take everything to the doorstep and we convince them on why it is important, because they don't have an idea. They are not medical students, they are not science students. We build partnerships. Nothing in this world can be done alone. And a mark of a good leader is working in synergy with partners and with other people. A man cannot rule the world alone. A man cannot do anything alone, but a man can take an initiative. That is the only difference. So I took an initiative and I understood what the problem was. I built a model around it, and then I built partnerships with nonprofits, with hospitals, with charitable clinics in all the hard to access areas of India. Then slowly we took it to Nigeria, we took it to Philippines, and we expanded globally. So after you've when you're doing all of this process, you have to do a test run of your intervention, and you have to take 100 or so patients, and then uh, you know uh, quantify your impact of whether or not what you were trying to do has had an impact. So this is a sort of a strategy which you must do around it. Now, coming to women in healthcare, as a girl and as a woman in the medical profession, the minute you say that you want to do something which is not in a routine normal path which has been laid out for you. So in India, most commonly, the path is that, okay, you do your MBBS, you do your internship. When you're in your second year of PG, you find someone to get married to, and ultimately you get married. And then the next step is that you have kids. The minute you tell your parents that, okay, I've got my PG seat and I want to also do something on the side. I am doing my PG, I am doing my what is required of me, but at the same time, I want to start a social non-profit as well. And I want to try and help other people. I want to try and help those who are in need in the country and abroad as well. So you are faced with so much of resistance that what is this? You cannot do it. There is so much of resistance from within your family, what to say of outsiders. And specifically, if you're in a small town, then everybody around starts to talk negatively about your decision to do something thoda hatke from your profession. Or even if you are in your position, even if you are in your profession and you say, okay, I want to start my own clinic, or I want to start my own center, I want to be a leader of my field, I want to do another degree, I want to do another fellowship, I want to embark upon certain imbibe certain more skills. The first thing you'll get is, what is the point? Your husband will earn, your husband will provide for you, you have to take care of the kids. So don't be over ambitious is the answer that doctors in the medical profession get. That okay, MBBS कर लिया, okay, MD कर ली, ठीक है, अब इसके बाद और पढ़ने की जरूरत नहीं है. You can just sit at home and you can handle your kids and your family, and that's it for you. But personally, I feel that there is a balance to be drawn between both the paths. There is always it's always good to have ambition, and it's always good to be financially independent. I think for women, that is the most important point, and that is where I think all of our parents, not just in small towns but even in metro cities, all of our parents are wrong that pehle shaadi kar lo and baki sab baad mein hota rahega. This is a wrong attitude. You have to be financially independent first, and then go on to building your family life. So that is the way things should go. And there's always a balance to be drawn. I'm not saying that what our elders have been teaching us is wrong. It's absolutely correct. You have to have a family. It's the way the world grows. But at the same time, if you do have an ambition in your head, I would say don't kill it for the sake of your family, and don't kill it for the sake of society. Unfortunately, in the medical profession, it's always the men who are given a slight leverage over us. But like I said in the beginning, this trend has been changing, luckily, and it has been, it has been on a changing trend. So I see Rohan very active and he wants to say something.
No. I was just listening to you. Please carry on.
Okay, so at any point you want to stop me, or you have some questions, then you let me.
Yeah, sure.
Okay, so so I think this is very obvious to all doctors that hunger. What are the consequences of hunger? And this is what we understood, that hunger gives a lot of nutritional deficiencies, and one of the most scary nutritional deficiencies is vitamin A. It's grossly overlooked. If you have worked in a big government hospital in pediatrics, you would have seen many children who were born with normal eyesight, but the eyesight gradually deteriorated, and then absolutely went away because of vitamin A deficiency. We are all taught the stages of vitamin A deficiency and how it proceeds in, I think, in final year and in third year. So I'm sure you're all aware of how bad the problem is. Now, coming back to my social enterprise, I was faced with all of these problems. I was faced with so much of resistance. क्यों करना है? मत करो, क्या फायदा है? शादी करो, ये करो, वो करो, अपने career पे ध्यान दो, ये NGO में कुछ नहीं रखा and all that jazz. But at the same time, I was very, very, very keen to do something on the side as well. It's still, I would say it's still a side venture for me. Mainly, I don't think it was mentioned in my introduction, but I am a neonatology fellow. So that is still my main focus. And I still work at least 3 24-hour shifts a week because of the fellowship. And I still work a lot in neonatology, but this is something that I do on the side. And initially, for the first 1 year, I had to give a lot of time to it. And now that things are more in place, I've got a very good CEO who handles everything. So this project I manage, in my spare time. It doesn't take up much of my time anymore because everything is in place. So the idea was mine. The direction was mine. The technology which we are making has been mine. And all of that creativity behind it was me. And now the implementation is being done by a lot of third parties and a lot of partners that we have in 5 countries. One of the countries is missing in this chart. And in India also, what happened was that I connected with this nonprofit in the US called Vitamin Angels, because I Googled and I saw that they are giving medicines, vitamin A free May, they are giving at 71 countries, and they're also giving deworming tablets, and they're also giving prenatal vitamins for pregnant women. So I just realized, that this is something that our people really need. And I studied in Ghaziabad, and that belt was very, very high on malnutrition. It was beyond bad. The number of cases of severe acute malnutrition that we got was just insane. So I was just reading about this organization, and I realized that this is something that our people could really deal with. And if there is an organization like this who's willing to give lakhs and lakhs of medicines for free, then why are people not letting it go to our children, to the children of our country, because we need it so badly. So then I spoke to them, and they said that we can't send you any medications until and unless you're a registered not-for-profit organization. So that was the next step. I had to register a non-profit organization, which again took a while. It took 3, 4, 5 months, and it took a little bit of money also. But because I was quite invested into this whole project, I got all that paperwork done. And we started off just in my college in Ghaziabad. We started in the pediatrics OPD. We used to give, on our vaccination day, we started giving vitamin A for free. And every child who was, a candidate for deworming, we used to deworm. Then in the gynae OPD, we started giving prenatal vitamins. So the problem in Indian scenario in pregnancy is that, mothers don't get nutrition and they don't get rest. Again, coming to a very, how should I say, it's a very patriarchal issue that the men folk get a majority of the food if there is, a shortage of food in the house. So, and even if the lady is pregnant, she doesn't get much food and she doesn't get adequate rest. She has to do all the heavy housework. As a result, she has severe IUGR. The baby is growth restricted, low birth weight. There are thousands of complications of low birth weight and IUGR that you all know. And most importantly, aside from the short-term complications, in the long term, it leads to obesity, diabetes, and hypertension, which overall adds to the health burden of a country. So to solve the problem, the best way to tackle it is when the child is in the womb. So if you improve nutrition in the womb, then you can actually cut down a lot of this health burden of diabetes and hypertension 30, 40 years later. So that is the way to do it is improve their nutrition. And aside from food supplements, which we are also giving now, high protein and high fat, the essential fatty acids that we give in the form of food, we also give a bottle of prenatal vitamins, which has 180 tablets with all the iron, folic acid. It's a sort of a combined pill with all the multi-nutrients that are needed. There are not separate pills for iron, folic acid, calcium. So it's given second trimester onwards till term. So the one bottle has 180 tablets, and we're distributing it extensively in the slums of Delhi, in Northeast India, in Bihar, in all the belts where malnutrition is extensively rampant. So this is how we started off, and after India, we spread to Nigeria, we spread to Kenya, and very recently, last month, we have started work in the Philippines as well. So it wasn't easy to break all of these. How should I say, patriarchal norms that I spoke about. Ki itna time isme kyun laga rahe ho, and uh, how should I say, if I think if I was a man, I don't think I would have been questioned so much on my life's choices and whether or not, I'm sure I would still be, by the way. I think it's not easy for any boy who wants to do a startup or anything aside from the normal career path. There's always going to be resistance ki isme paise mat waste karo, and this your idea is stupid, and this is stupid, and blah 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 from parents. But at the same time, I think for women it's a lot worse because of the kind of societies that we brought up in. Rohan, is it going okay? Should I
Yeah, it's pretty nice actually. I was going to ask you this same question. My first question to you was, what is this? Every infant matters. What is this? Kindly explain us this thing. Now you already did that pretty
I
well.
did, yeah. Okay,
My
so
next question was also very same, that what are the problems you faced as a woman while running this
yeah.
NGO, and what was it? What do you feel that if had you been a guy, you wouldn't be having this problem? But this is only because of your
I
gender.
think, yeah, I think I would have not had so many. So even when you go to, say, a government office, just to get your registration done, you go to State Bank of India to open an account. The approach is very different if you're a man, the approach is very different if you're a woman, and the approach is entirely different if you are someone from the marginalized sector. That is the problem. Inclusivity is lacking everywhere. Tomorrow, if I was if there some transgender person goes for the same thing, or if some disabled person goes for the same thing, they'll all be looked down upon, and they'll not be taken as seriously as able-bodied people. So the problem is about inclusivity more than feminism. I think it's a humanity problem. Like, instead of a feminist, I would say I'm a humanist. That it's, at the end of the day, we're all humans, and it has to be an all-inclusive society if we are to progress as a nation. So that's the thing, that anyone it's just not inclusive. It's just so much bias based on caste in the country. There's so much bias based on religion, minorities. Tribals face a lot of problems. So one of the areas, in fact, where we work is Mirzapur. So Mirzapur has a very, very dense tribal belt. If you've all seen the show, you know what Mirzapur is like. I haven't seen it, but I've heard. And Mirzapur is very densely populated with tribals, and those tribals are in such a abysmal state because nobody wants to go near them. They think that they are achut and they are, dirty people, and they have nothing. Nobody hires them. They don't have any livelihood. So sometimes they have such less food that they are forced to eat rats. So that's why the tribe is called Musahar tribe. Okay. So when we went to those tribal areas and we distributed ration, and we said to them, that have you taken the COVID vaccine? So they said, COVID kya hota hai? And this was in 2020 end. So you think of the situation that they are so isolated from the rest of the world that they don't know what COVID, they don't know there is a Vishwa Vyapi Mahamari in the country. They don't know about it, that they don't know why suddenly one of their members got breathless and died. They have no idea. They don't know why 50-60 of them died in the Delta wave. They just didn't know ki kya hua. So it's very, and then when we tell them that ऐसी बीमारी आई है, इसका आपको टीका लगवाना है, so you and I going into a strange area with our different clothes, with our different language, it's not going to work. Okay, it's not going to work if I go there and I tell them that XYZ disease has come, and this new drug which the government has made in 1 year is going to save you from it. It's not going to happen. So the solution to this problem is community empowerment. Right. So I'll come to community empowerment. So This is how we work. Okay, we reach the needy at the very last mile. Last mile delivery is what is lacking in the government's excellent health programs. All hats off to the government. I feel that the government of India has got excellent health programs in place, whether we're talking about your NRHM or your Mission Indradhanush or any of them. But the problem with all of them is that they're all very scattered. They're not there in the hard to reach inaccessible areas. There's nothing in Mirzapur. There is nothing on the Indo-Myanmar border, which is conflict ridden. There is not even a single COVID center or anything for at least 100 miles in that Manipur area, which is near the Myanmar border, for at least 100 miles. So, this is where the government is lacking. It's not taking healthcare into account when it comes to expansion. It's not taking healthcare seriously enough is what I feel is the only thing which is problematic here. So, what we do is we work alongside the government. We utilize what the government is already doing, like the Ashas and Anganwadis, jahan pe hain, we reinforce those programs, and jahan pe nahi hai, we add our own. So we work along with the government because, like I said, I feel like the government has excellent stuff in place. The only problem is that the last mile access is lacking. Secondly, like I said, if I go into a tribe and I say that this problem is there and you do this for us, you do this to save your people, they're not going to believe me. So the solution is that you empower and train local people, right? So what you do is that you speak to the religious and social head, like the panchayat head or the head of a tribe, and when you explain things to them and they take it forward to their people, then it makes a much bigger impact. So they can explain it in a way which is socio-culturally acceptable. There are cultures in the country who don't accept vaccination, who thinks it's harmful, and they think that jhadphook is what is going to save them. So you have to reach out to them without hurting their religious sentiments. That is also a very big issue in the country. The only way to do it is that if their own people say, and if their own heads say, their own people who they trust say, then that is the only way to reach out to them. And that again, I think as a woman is where we are. You are at a disadvantage, that you will be taken less seriously as compared to other people. So it's just an example of a last mile delivery in Nigeria, where there are islands in the middle of a very turbulent river. And again, on those islands, there is no healthcare facility for sight. So these are health workers in Nigeria, and they go on boats taking cartons of medicines to give to those people. So again, this is a good example of last mile delivery. Like I said, you always have to work in partnership. And one of our partners is this medical organization, which did 225 camps in Delhi on the same day. And on a single day, 4,500 children were given vitamin A in deworming. So partners ke saath hi you can get a bigger impact. If I was just alone in Delhi, I cannot travel everywhere so much, right? So I have to have synergistic partnerships where we give them something and they give us something. Like we give them training, we give them medications, and they carry out the implementation. That is the way. So suppose there is let's say there is a group there's a group of volunteers in the Northeast which is helping people in COVID, and they say that ma'am हम करना चाहते हैं but हमें नहीं पता कि COVID को कैसे treat करना है, COVID के patient में क्या क्या ध्यान में रखना है. There are people like that, and what we did was that in the second wave, when the pandemic had died down a little bit in the metro cities, it really went up in the Northeast, and at that time there was a very big crunch over there. So we set up a COVID center, and this group of volunteers who really wanted to help but couldn't help because of lack of training, we trained them in COVID remotely, of course. So we trained almost 1,300 health workers across 9 countries in COVID to deal with the pandemic, to deal with the patients, to use PPE, how to protect yourself, how to identify danger signs. And these are all informal healthcare providers. Some were nurses, of course, but most of them were informal healthcare providers. So we taught them, and we send them resources, we send them oxygen concentrators, we send them thousands of PPEs, and we just built up upon what they gave us. They had like one building which of their organization which they wanted to use. So all the stuff and the guidelines on how to establish that COVID center. And currently that COVID center is the only facility for those 70 villages on the Indo-Myanmar border. So that is running, and till date we've treated almost, I think, 300, not treated, I would say isolated, more than 2,000-3,000 of patients. And in the second wave, I remember there were 150 patients admitted there. So we've done a fair bit of work in the interiors with the help of partners. So impact so far, this slide is a little old. We've come to 69,000 children who have been given vitamin A to prevent blindness. Almost the same 61-ish thousand children have been given deworming tablets. 42,000 pregnant women have been given prenatal vitamins, and thousands of families have been counseled on the good and bad practices of childhood, on the horrible practices that exist in the society, in Indian society. Like they put cow dung on umbilical stumps, they'll discriminate against the female child, they'll give the male child more to eat, they'll send the male child to school. They'll just they'll just let the female child do housework. But this is the way we help them. We tell them on how to be gender inclusive, and how to be reduce. We want to reduce the stigma around tuberculosis, around HIV and disability. So this is another thing that we do. So talking about health system strengthening, where we train, in healthcare workers. So 1,300 nuns in 9 countries, and around 100,000 community health workers in Nigeria were trained during COVID. So this is what we did. Okay, so coming to goals, this is interesting because what we've done now is that we've focused a lot on technology. And, technology is something that as medicos, we can really utilize for thousands of things. And we already are, like all of us are using apps like UpToDate, Medscape, everything on a daily basis. As pediatricians, we have apps for dosages to calculate the expected date of delivery. We have apps for almost everything. So we've already got a lot of apps in place. The place where apps are lacking is public health. So what I thought was that why not have a system where, again, the problem comes down to a crunch of doctors. We cannot have as many doctors as we need, because that ratio is so grossly, it's so grossly, disproportionate, that by the time, even if the government decides to increase the seats, double bhi kar de wo aaj, तभी भी वो डॉक्टर्स को, स्पेशलिस्ट को फील्ड में लाने के लिए एटलीस्ट 10 years लगेंगे. So the next 10 years, I think remote medicine, telemedicine is the way that we have to go if we really want to help people who don't have access to medicine. That is the only way. And another good way is if you train and empower local people in communities, and that's what we're doing. So suppose, like I'm talking about Mirzapur. Suppose I can train some semi-literate, individuals in Mirzapur on how to recognize danger signs. So if we can, in COVID, so suppose I can do that. That's not very difficult. What are the danger signs of COVID? There's cyanosis, there's fast breathing, you can give them an oxygen saturation probe, they can check the saturations. That's not very tough. And at the same time, if immediately after doing these checking of danger signs, if they can connect, if there are danger signs present, if they can connect remotely with a doctor, then think of the number of lives we can save. Like, just think of it logically, that most patients die because most children die, and most adults also die because the family and the people around and the patient themselves are unaware that this is a problem. Like, how we get patients in our emergency with 600 sugar, and then you ask them ki kab se aise sweating ho rahi hai, kab se aise saans फूल रहा है, दिल से तो 3 दिन से ऐसे है, तो क्यों नहीं आया हॉस्पिटल में, पता ही नहीं कुछ गड़बड़ है. Like same with in children, this is an even bigger problem. You'll get a child with intercostal retractions with a respiratory rate of 80-90, and you'll ask कि कब से पसली चल रही है, they'll say तो 2 हफ्ते से ऐसे है. And then, by then respiratory failure would have set in. There's not much you can do after that. And we all know the kind of ventilator access that we have in our public hospitals. So if we can tackle the problem in the beginning, send someone door to door from within the community to look up into these families, to check on them and see, yes, kuch khatre wali baat to nahi hai, then I think a lot of lives can be saved, and that is what we have built now. We have built a e-triage system, which is being implemented as we speak, and we'll have more like, because we're doing a pilot study now. So as soon as we have quantifiable results, we'll be able to take it up on a much bigger way. And we're trying to collaborate with the government so that the ashas and anganwadis can also get a similar, some similar concept, and we can work ahead with them. So this is what technology can do for us as medicos. Even otherwise, even if nothing else, even if just as medical students, if we have families, if we have domestic help at home, if we have relatives in our hometowns, in our villages, who don't have much knowledge or who don't have much access, I think informally all of us are telemedicine experts now, especially since the pandemic. Even if you're an MBBS first year, I'm sure people have called you and asked ki hamare ghar mein COVID ho gaya, please bata dijiye kya karna. I think all of us have gone into that frame. But specifically, I would say that, utilize WhatsApp video, utilize this to help as many people as you can, because tomorrow it could be your own family who needs help, and you really need to like, there's a quote in Sanskrit called Vasudev Kutumbakam, which my nani always says, and it means that the world is one family. So try to think of it that way, that kal ko hamari family mein, God forbid, koi problem hogi, and then we will need XYZ doctors to help us. So be that XYZ doctor today for someone else. And destiny is such and fate is such that somewhere that act of kindness will come back to you. And that is what I feel is my approach as a doctor. This is just a financial model, that if you invest $1 in every infant matters, the social return on investment is worth $72. So what they do is, in social return of investment, they calculate the quality of life index, and they calculate the number of lives saved and number of lives benefited, and they quantify it, and then they divide it by the amount that we have spent, and this is the return on investment that they get. Right. So like Rohan was asking about challenges. So, it's been very challenging. Working with the government is challenging. Funds for NGOs are very, very limited. And as you know that there is a bit of a corruption issue which happens. And, hota to hai that, people try to tell you that, hum aapke liye, we'll get you so much funding if you give us this much cut. And this is stuff which, I personally can't indulge in, because I'm a very God-fearing person, and I don't want to do anything which is not strictly right. So we've had a lot of challenges with funding. We've had a lot of challenges with people not accepting NGOs. Like, even in my hospital, if I'm just talking, like last month in December, we did a blanket donation drive, and we were just collecting 100 rupees per blanket to distribute to the poor. And people, they just start thinking ki, you're going to do some ghapla even in this. So NGOs in general are not very well respected. People always associate NGOs with ghapla and with money laundering and with all of that. So that acceptability also is a little difficult to come by. And as a woman, we are emotionally very strong, but we're also a little on the sensitive side. So it does take a toll on your mental health when you're faced with so much negativity. That is also, I think, a disadvantage as a woman, but that is just what nature has built us with. Nature has also built us with a lot of resilience and with a lot of courage to fight all of that negativity, but it is taxing sometimes. So just a little bit about what are enablers for scaling. I already spoke about, this is all very technical. I don't think I'll get into it. And this is just what we want for the future, that no child should go hungry and no child should die of a preventable illness or die or get disabled or, suffer through any kind of misery, specifically when it can be prevented. Like I said, we have things we can't prevent. There's retinoblastoma, there's Down syndrome, there's just, polytrauma. Just 2 days back, someone came in the emergency and the bike had fallen off the flyover, and this child had come with polytrauma and didn't make it. So these are things which are unfortunate, but I think what is 1,000 times more unfortunate is children becoming blind because of lack of food, a child dying because of lack of a ventilator, child dying because the parents thought that dog bite ke baad jhad phook is enough. These are the things which really hurt you even after 10 years in the profession. And these are the things that will hurt you, I think, hurt a person like me. And if you're slightly emotional and sensitive, they're going to haunt you lifelong. So this is why, to combat those horrors, is why I focus a lot of my energy into altruism and into charity work. And we've had a lot of success so far. So this is what we've been doing. So coming to something which is not covered here, which is something where I think leadership really was required, was the second wave and the humanitarian crisis that followed. Because at that time, aside from being a doctor, it was very important to be a good human being as well. Everybody was trying to help as many patients as possible. But there were times when people would call you ki oxygen cylinder kahan se laye, because 8 ghante ki line hai and hamara oxygen आधे घंटे में खत्म हो रहा है. There were times when people would call and say remdesivir is not available, or they would say bed chahiye, ventilator bed chahiye. Yeah. Worst was that my father is admitted in Ludhiana as some government hospital, and I've not heard from those doctors in 3 days, and I need an update. I don't even know if my father's alive. This was the time when I feel the medical community, specifically young doctors, really came together to fight and to help the people as much as possible. So what I did was, I was added into one of the medical association groups where we had first started off a helpline with a lot of volunteers. Most of the volunteers were medical students and interns, but there were some PGs, there were some seniors as well. And what happened with me was that I got COVID along with my entire family in the second week of April. That was when the pandemic was beyond its control, but bilkuli there was no resources available. So my grandfather was 93. And I knew immediately within, as soon as we got the test positive, that we are going to need remdesivir, we are going to need an ICU bed, and where are we going to get it from? And mind you, both my parents are senior consultants in COVID hospitals in the city. We have 6 doctors in the family, and even then, we had to wait for 8.5 hours to get a bed. We had to arrange medication from XYZ sources after making 300 phone calls, and that also took 2 days. We had to really push when the time came for ICU. We had to use contacts beyond contacts. So that just made me realize that, I am from a privileged background. What is happening to people on the road who don't have this kind of help? And that's when I started a COVID task force. And that task force was called the Kindness and Empathy Group. And it has even till date, it has 165 members. Back then, everybody was working round the clock for that particular group. We were getting requests from Instagram, from Twitter, from phone calls, from people. We had given a number on that. That number had gone viral, and we were just helping round the clock. What our volunteers were doing, and most of them were doctors. They were just picking up leads from the internet, oxygen leads, bed leads, and verifying them in real time to connect them to the patient's families. A lot of interns, PG students in different hospitals across the country helped us with patient updates on how a patient, I suppose there is a patient who needs an update on their family member and nahi mil pa raha hai. I've had people personally go and check in their particular hospital for many things. So this is what we did, and I'm glad to say that we've been able to help almost 32,000 patients till date. The problem kept evolving. Black fungus came and liposomal amphotericin B was not available. And then came the time when we started arranging for that. when we got the medicine, suppose the medicine is available in Chennai and it's needed in, say, Jammu, how to send it from there to there. So, we had help from Indigo, the airlines, we had help from the railways to transport the medicines, we had help from all kinds of sources, and we really, really stood up to the challenge and helped so many people. So I think leadership in essence is all about just channelizing whatever skills you already have. I'm not saying that you have to be a doctor. You can be in any profession, you can be in any frame of mind. All of us at that time had family members who had COVID, and all of us, in fact, my grandfather died in that time. And at the same time, the only outpouring of the grief, only way to distract yourself from all the issues and get some solace was to help others in that time. Because when you help others, you feel a sense of fulfillment from within. And at that time, in that humanitarian crisis, when all of our families were suffering, I think that was very, very, very important. So I think that's my story in a nutshell. I'm bahut bol kar liya. I'll hand it over to Rohan. And
I think your story is pretty much heart touching, and everything what you are doing and what you have done till now, it's really commendable and really appreciable.
thank you.
I was just thinking that India is so much age-centric and a patriotic society. Like you have both the things in your downside. It'll be like ये तो young है, ऊपर से ये लड़की है. So even I feel the same things when I go around, when I speak to someone in the, like a health commissioner or health minister, they think that, okay, one should also
Yeah,
take an
don't take
opinion
it
of some
seriously.
senior fellow and something should be there. And just thinking that, okay, fine, at least I'm a boy, so that is there, that there is an undue advantage, which is not said, which is not spoken about, but everybody feels it, and it is there present in the society.
Yeah.
So I have that advantage, but you don't even have that advantage, and still you have achieved so much at such a young age. It's really, really tremendous. And I also wanted to ask you, like you just told that your parents are doctors, so that means that I don't think there would have been much of a push कि तुम्हें ये नहीं करना है, you have to do
No,
this
no,
or do
no.
that.
There was massive push because my father was all about, okay, you have done your now. Why don't you start preparing for DM and don't waste your time? And my father's from AIIMS and everything, so the pressure is 1,000 times more when you have parents from the same profession. See, if you don't have parents in the same profession, you can at least say that, you can at least be that mindful that they don't know that much about what your career trajectory should be. But in this case, they are all about DM and fellowship and this and that. Now I'm finishing neonatology, so my father's like, now do PICU. So it's madness, it's madness, the kind of pressure. And there's always like, when I started working in Apollo, that's my first job after PG, I joined Apollo Pediatric ICU. And my father's a consultant there. So there was always, and I just come out from Santosh, and in Santosh, you don't have that much of exposure. So I was just like thrown into the deep end of a very, very high-end ICU. So I was quite clueless. And everybody used to like, think ki, she's got the job because her father's here. So all that is also pressure. All that, expectations, all that pressure of not wanting to let your father down and everything. So it's quite how should I say, it's unnerving to work in the same hospital. तो rounds ले रहे हो, दिख जाएंगे बीच में कहीं, then he'll ask 10 questions. आज क्या किया, आज क्या देखा, अच्छा ये देखा, इसमें ये क्यों नहीं किया, गलती से, तो my dad's an endocrinologist, गलती से कोई एंडो का केस दिख जाए, अच्छा ऐसा ADH हुआ उसको, ये नहीं किया तुमने, ये नहीं किया, तुम लोग करते क्या हो. So it's all pressure. And then sometimes we initially for the first 1 week we used to go to work together, and then on the way he used to take my Viva, then I stopped going with him. So I don't want this pressure early morning.
Well, I think that is also true. But when you have parents who are doctors, they'll be like, they know the trajectory. Like if you don't have parents who are doctors, they're like,
At
okay,
least you
fine,
can,
he's a doctor
sort of,
now he's a
yeah,
big deal. But
yeah.
when your parents are doctors, then they're like, abhi to MSc kiya hai, do your MCH, do this, do that. So that is always there. But still, one of your colleagues, I think your junior, Dr. Rafia, was there in ESI Okla, and she was
Yeah,
also
yeah,
telling me that you were quite active in the COVID period also, and you have helped a lot of people. So it's really commendable what you are doing for yourself as an independent also, and also for the whole women community and women doctors who thinks that they have to be under someone's roof, or they have to be protected by someone. Like there should be someone in there, be it a boyfriend or be it a husband, there should be someone who will protect me. So it's you are actually a really good COVID warrior, I must say. And it's really beautiful to have you here in the show, and it was very nice for you to give us time to come here, and I really appreciate it. And I hope that in any manner, if we can collaborate or we can help each other,
definitely.
it will
So
be very
yeah. So if we'll get in touch later on any
yeah.
collaboration, there's lots of things we can do together, because we
Sure.
always need.
And I want you to sign off the show. One last message for all the women doctors who are watching the show, who will be watching the show. Just last word should be yours, and happy Women's Day in advance.
So I think what I'd like to tell all the women watching is that don't be scared. Have courage and be kind, and follow your heart, and always remember that nothing is worth your peace of mind, and you have to be standing on your own feet before going into any sort of marriage or any sort of commitment like that. That is the only lesson that I have learned from a lot of my friends' stories. I have some friends who had not even completed MBBS, and their parents got them into an arranged marriage, and they got married, and unfortunately the marriage didn't work out. Now you've not even done your PG, and you know what it's like in the medical world. If you're still struggling as an MBBS, so it's quite. I would say just be your own person before you can be someone's wife, someone's mother, or someone's doctor. Be yourself first. That is the take-home message that I would like to give all the women listening.
Great. Chala, we should wrap up. Thank you so much for coming.
Thank you, Rohan. Thank you, Venkatesh. Thank you, Nishita. Thank you. Bye.
Thank you. Bye.
Bye.
Thank you so much, ma'am. Bye, everyone. So with this, we are concluding the session here now.
Sure.
Thank you, sir.